The specific challenge this presentation will address is suicide prevention for sexual minority youth. Preventing suicide in sexual minority youth is an extremely important challenge that needs to be addressed because LGB youths are between 2 and 7 times more likely to attempt suicide than their heterosexual peers. Suicide prevention in the sexual minority youth population requires urgent attention because the LGBT population is consistently overlooked by suicide researchers, even though they are known to have high rates of suicidal thoughts and behaviors. The consequence of this lack of research is that there are huge gaps in knowledge and barriers to progress that exist regarding suicide in the LGBT population that interfere with the development of prevention programs in the LGBT and sexual minority youth community. One gap in knowledge that maintains this challenge is that most of the researchers studying STB risk and protective factors in the sexual minority youth community typically only include LGBT-specific risk factors in their research, rather than looking at general known risk factors and LGBT-specific risk factors together. Including both sets of factors in one study allows researchers to understand the deeper connections that may exist between them. A second gap in knowledge is that no study has ever tested the effectiveness of a suicide prevention program for sexual and gender minority youth. Therefore, no evidence-based suicide prevention program currently exists that is specifically designed for sexual minority youth. A third gap in knowledge is that all previous studies about suicide attempt risk factors for LGBT youth have been cross-sectional. Cross-sectional studies don't allow researchers to determine causal relationships between risk factors and suicidal outcomes. So all the information researchers currently have about suicide attempt risk factors for sexual minority youth are correlational, which limits their usefulness and legitimacy. One barrier to progress is that little research has focused on how suicide risk and protective factors may differ between various subgroups of sexual minority youth. Thus, researchers don't know how accurate these broad risk and protective factors are for each subgroup. Another barrier to progress is that LGBT status is seldom reported as a demographic variable in longitudinal studies of suicidal thoughts and behaviors. Thus, data about the LGBT community's experience with suicidal thoughts and behaviors is very limited. One preliminary step that has been taken to address this challenge is that Mustanski and Leo have begun evaluating LGBT-specific suicide attempt risk factors and general suicide attempt risk factors together to understand whether any mediating effects exist between the two types of risk factors and how these effects may impact suicidal thoughts and behaviors in sexual minority youth. Another preliminary step is that Horowitz et al. Have begun identifying certain suicide risk and protective factors that are not only specific to sexual minority youth broadly, but that are also specific to subgroups of sexual minority youth. One evidence-based initiative I would propose would be a one-time school-based intervention for K-12 schools that seeks to create or enhance sexual minority youth supportive and protective climates in schools. No such protocol currently exists, but Hatzenbuehler et al. List characteristics of sexual minority youth supportive school climates that I would use to develop my intervention methods, such as the presence of gay-straight alliance programs, school courses related to SMY-related health concerns, the banning of sexual minority-based harassment, support for staff and teacher involvement in programs that help them learn how to produce protective climates, and by providing resources for SMY students to access LGBTQ+ friendly services outside of school. My evidence-based initiative builds on existing findings that sexual minority youth students at schools with supportive school climates have lower rates of suicidal ideation. Additionally, Marshall found that sexual minority youth typically experience less school support than their heterosexual peers, and that when sexual minority youth students feel less supported by school staff members, they are more likely to experience suicidal ideation and suicide attempts. Thus, my intervention would require all school staff to receive training on how to be more LGBTQ+ inclusive so that they are better able to support sexual minority youth students. Lastly, Swayak et al. Found that schools with gay-straight alliance programs and anti-homophobic bullying policies were less likely to have their sexual minority youth students, mostly heterosexual female students, as well as straight male students experience discrimination and suicidal thoughts and behaviors. Thus, my school-based intervention would include a gay-straight alliance program and disciplinary policies for students who engage in homophobic bullying. A decreasing trend in self-reported suicidal ideation among K-12 students would suggest that my school-based intervention was effective.